Hi everyone, myself Dr. Kirti here. Welcome to Pathology channel. So today we are going to learn about the short concept about granuloma, which is very important for UG and also PG. Definitely, you can't skip this topic in pathology. Either it will be asked in Viva or practicals. Definitely, it comes into the role. Okay, so let us learn in a very simplified way. Okay, imagine some dangerous criminal who enters the city. Who is responsible first? The policeman comes into the role first. They don't have the power to kill him, but they have the power to imprison them. So this wall, the prison wall, is nothing but your granuloma. So imagine like a story, your body is the city and the dangerous criminal is nothing but which is responsible organism is Mycobacterium tuberculosis. So they enter your body. They are considered as criminal. So here comes the policeman. Who's this policeman now? Macrophages, definitely. They are the first acting defense mechanism. So the macrophages comes into the role where they cannot kill them. They don't have the power to kill them, but they try to defend them somehow. Okay. So what do now? They send some signals to headquarters. Who's there in headquarters? T helper cells. Okay, so this T helper cells, like the command center. So this T cells say that we cannot destroy it, but somehow we lock it. That mechanism, they release the interferon gamma and IL-2 and everything. I'll tell you about the concepts later. Okay, so this turns the normal macrophage into supercorps, that is your epithelioid cells. So they transform macrophage into epithelioid cells. The transformation is the one which is responsible for this. So the macrophages turn up into bigger cells, elongated cells with central nucleus. So those are called as epithelioid cells. They fuse and form, there is nothing but it's called as Langhans type of chain cell. So that is also an important mechanism for defense mechanisms. So here the wall is going to build up. How do they build up now? So they trap all the mycobacterial organism into the center and they form it like a caseous necrosis. So that is in the center, like a cheese-like material. So that is known as a dead zone. Okay. So surrounding that, you will be having the criminal will be trapped inside now in that caseous necrosis. So surrounding that, you are having many layers. So the outer layers are surrounded first by the epithelioid cells and your multinucleated Langhans type of giant cells, and the last like a like a cement's rigid structure. That there comes the small lymphocytes and also your fibroblast cells. So this whole structure is known as a granuloma, which is a well-formed granuloma where the organism cannot escape from the wall. So this is the perfectly organized prison made by our own body. So you remember, this is not just an inflammation, it is a defense mechanism made by your body, which is responsible for that is type 4 hypersensitivity. So you should always remember the best example of type 4 hypersensitivity is granuloma formation. Okay, so this prison is like, the center one is dead cheesy, I told you, surrounded by epithelioid cells, multinucleated Langhans type of giant cells, fibroblast and everything. So the giant cells are not only specific to tuberculosis. Sometimes whenever you see caseous necrosis along with giant cells and granuloma, so definitely you will diagnose it as tuberculosis. Apart from the non-caseating necrosis, and you are seeing naked granuloma. What is naked granuloma? It's like the small lymphocytes will be absent. So if you are seeing that kind of granuloma, your mind should think of differential diagnosis of sarcoidosis. So remember that. So granuloma is the body saying that I cannot kill you, okay, but I'll make sure you never escape from my trap. So that is a well-formed organized granuloma which is formed by a type 4 hypersensitivity reaction from the body. Fine. So what are the key elements here? CD4 T cells is the one which is highly responsible for this pathogenesis, and other three, they releases the cytokines like interferon gamma, which is responsible for transformation of macrophages into epithelioid cells, and IL-2 interleukin 2, which is responsible for T cell production and proliferation, mainly TNF alpha, that is the one which maintains the granuloma. So these are the key core concepts about granuloma. I hope so you all understand. Let us learn with new concept in some other classes. Until then, bye bye.